My name's Bea. I'm one of the third year medical students doing laparoscopic surgery at the Delta Centre. Me and two other students have created a teaching series on how to become a surgeon, and today I will be covering scrubbing in and theatres. So let's get started. So what is it and why do we do it? So surgical scrubbing in, or scrubbing up, however you want to call it, is a thorough cleaning of your hands and your forearms by medical professionals prior to participating in sterile procedures like surgery. So why do we do it? We do it to minimise the risk of patient infection. We do it to remove the transient flora and reduce your resident flora. And also we do it to maintain what's called asepsis in the operating room. So OR you might have heard of before. So how do we scrub up? We have a video on how to scrub up, which might be easier than talking through it, but I have put pictures and instructions step by step, so we'll talk through it now, but it might be easier for you to just watch a run through on how to do it as well. So first of all, we start off by removing jewellery like rings and bracelets and watches. We look at our hands for any cuts and we clean under our nails. There is a toothpick included in the pack that you can use to get dirt out from under your nails. And we prepare the sterile field with the sterile gloves as well. And we also make sure that before we do any hand washing, we put our face mask on. Then we wet our hands in one direction, so you do it from fingertips to elbows like this. So if the water is running down the middle, I will wet my fingertips to my elbows like that in one direction, making sure not to go back and forth. Then we apply our antiseptic. A lot of the time we use our elbow to click on the dispenser, just because our elbow is the last bit of we'd call dirty part of our body, because we are washing our hands and forearms up to our elbow. So we use our elbow and using what we have in the pack, so a sponge scrubber, you scrub each area. So you do your fingernails for around about 30 seconds, your fingers, your palms and your forearms you do around 10 to 15 strokes. After that, you do it obviously on each hand. Then you want to rinse again in one direction from fingertips to elbows without reversing, like how we wet our hands in the first place. Then you want to repeat all of these steps 3 times. In terms of drying, there is a sterile towel in the pack. So you want to start from the top of your hands to elbows, making sure to pat dry, not rub, because rubbing is back and forth and you want to go in one direction. And also, once you've used one sterile towel on one hand, you put it in the bin and you use the next sterile towel for the other hand. Okay. Then in terms of gowning and gloving, so that is putting the sterile gown and gloves on. So you want to take your gown from the aseptic environment that it comes in, and you want to shake it out a little bit, but make sure it doesn't touch anything. So it's folded up as you can see in picture 1, and you need to shake it out kind of round about to picture 3 so that you can pop your arms in. So you place your hands through both of the sleeves until you reach the white part, which is shown in picture 5. So that part of the sleeve is elasticated, and you want to keep your hands under that area, making sure not to put your fingers through. Then you can ask someone to adjust the shoulders and tie the gown up at the back. And then in terms of sterile gloves, so you grab the sterile gloves using those white parts of the gown, as shown in picture 7. And then using your other hand, so you pick it up like this and you use your other hand to slide it over and put it on your hand. It is quite complicated to explain. It's a lot easier if you just watch the video, and hopefully you can understand the technique that it entails. But once that's done on one hand, you repeat it on the other hand, and then you're allowed to touch the gloves and adjust as needed. So as you can see on picture 9, we still retain some of the elasticated band kind of around about to this part of the hand, just to, really keep that aseptic field. So yeah. In terms of during surgery, so this is something that I learned during my placement. I had no idea that this was a thing, but if we are observing a surgery and we are not getting our hands involved, then we need to make sure to keep our hands above our waist and visible at all times. So sometimes adopting this position, which I will show you now. So like this, because then your hands are visible, they are above your waist, and they are, a comfortable position. Sometimes surgeons will ask you to touch the sterile field on the patient with your hands so that you don't accidentally touch anything else. This tends to be more, during the start when we're getting used to being scrubbed up in a surgery. So if that's easier, you can also do that. Just place your hands on the sterile field that is still above your waist, and your hands are visible and they are in a sterile environment. If, however, there is any contamination, then please make sure to tell someone and re-glove and re-gown immediately, because then that poses the risk of infection to the patient and the procedure. So in terms of theatre setup, I have gotten a picture of a theatre and tried to label it for you. So let me get the pointer out. And so we have the anaesthetic trolley. So the anaesthetist will be in control of this, but you will be seeing this in every operating theatre. They will be in control over it, so do not touch it. Then we have the operating table itself. We have the lights that you can move. We have ventilation, which you will notice every operating room is cold. This is because it's being ventilated at all times. And then we also have a screen, which if you're doing laparoscopic surgery, then that is where you see what your camera is showing you. So that is also movable so that it's closer to the operating table. So that's kind of what a theatre looks like. Obviously every theatre will look slightly different, but those are the key components that you would see. Then in terms of theatre staff, so you will have the main surgeon, which is the consultant, with another surgeon, which is the training surgeon. They will be working hand in hand during the procedure. Then we have the anaesthetist standing by the patient's head. They are always by there as if they need to ventilate or do any emergency intubation or anything, then they are there. Then we also have what's called a scrub nurse. So this is a nurse that's scrubbed in, that passes all of the instruments to the surgeons when they are asked. So obviously there are more people that you're going to encounter within a theatre, but these are the main ones to be aware of. Making sure that if you are not scrubbed up, you do not come close to the surgeons and the scrub nurse, because then it could contaminate the surgery. So everything that's blue here is sterile. As you can see, the anaesthetist is not scrubbed up, but they have popped a little tent up with the sterile field so that it kind of blocks off the anaesthetist in a way. So that's all for scrubbing in and theatres. As I mentioned, there's a video of scrubbing up that might be easier to follow than the step-by-step instructions, but hopefully you now have an idea of what to expect from a theatre.